Hello and welcome to the tip of the day. I'm Dr. Amy Starr with the Mesa Veterinary Clinic, Paws-n-hooves, Mole Veterinary Services, and San Francisco Stables. We're helping El Paso help their pets. So today I want to talk about mouth issues, common mouth issues with cats, and some of the things to watch out for. So there's a couple of main mouth issues that we can see in cats. Obviously, you can have dental disease, just like anybody. You can have foreign bodies, meaning things that are stuck in the mouth. You can have stomatitis, which I'll explain in a little bit. You can have tumors and other things like that. And you can have a syndrome called feline orofacial pain syndrome. And so important to kind of be aware of those things and be aware of your kitty. If you're noticing that all of a sudden gradually your cat is drooling, chewing, licking, pawing at the mouth, shaking its head, any of those things, those are all signs of pain and discomfort. And they could mean that something is, or well, they do mean that something is going on in the mouth of your pet. And so you need to try and do an exam at home. See if you can open up the mouth, look inside, look at the teeth. Those teeth should look like nice, healthy white teeth. There shouldn't be any red gums or inflammation. And sometimes if they'll let you, if you kind of push at the base of the tongue, you can look underneath the tongue as well. And so kind of talking about each one of those individually. So dental disease obviously is very common in cats. Most cats don't let us brush their teeth very well. And so think of ourselves, if we never brush our teeth, we never floss, we never chew gum, and we never go to the dentist, we're going to have nasty, horrible teeth. And so this is what happens with our pets when we don't give them the care that they need. So always, always, always try to brush your pet's teeth, give them dental chews, and take them annually to the vet to get a dental cleaning. Taking them to the groomer is not dental cleaning. They basically try to brush the teeth as best they can, but if you're only doing that once in a while, it's like us brushing our teeth, once in a while. It needs to happen daily. So try to brush your cat's teeth, give them dental chews, and take them to the vet for dental cleanings at least once a year. So dental disease is quite severe and common in cats, and they can actually get cavities and resorbed roots and broken roots and things like that. And all of those things can cause severe inflammation, severe pain, and discomfort and infection. We see tooth root abscesses where they'll get abscesses up in the cheek or down here on the jaw. We can see broken jaws from the abscess, degrading the bone itself. And so it's a very serious and important thing to be aware of. Okay. The second thing is foreign bodies. So cats are great at playing with little objects and chewing them and getting them in their mouths and shaking them around and batting them around and stuff like that. So it's not uncommon for us to have cats come into the clinic that have swallowed or eaten something like a string or a rubber band or a toy or a yarn or anything like that. And sometimes those things can get stuck on the tongue and you can't always see them because it's hard to open up a cat's mouth. And so, like I said, we try to push on the base of the tongue so we can look underneath. But that's actually one of the first things we look at when a cat comes in with the complaint by the owner of licking or chewing or drooling, so salivating or pawing at the mouth or things like that. We look at the dental disease and we look for any foreign bodies. And so those are really important because those I've seen severe lacerations and issues with things getting stuck around the tongue. The next thing is tumors. Obviously, they can get tumors in the mouth just like they can get tumors anywhere. We recently had one that came in for drooling and pain in the mouth. Looked inside the mouth and the teeth were horrible. Basically rotting out of the mouth. But I could also see some kind of a swelling down in the mouth in the back. So the cat was really painful. So we couldn't open up the mouth wide enough for me to take a look. So we did some sedatives with pain relievers, and that way we were able to open the mouth and look in there. And there was a large tumor. And so sometimes tumors happen just because. A lot of times they happen because of the dental disease. All that inflammation and infection actually causes the cells to mutate and form cancers. And so that's another reason why it's important to maintain the dental care of your cat. And so, again, watch out for any bleeding, drooling, pus, swelling, pain, and try to look in your cat's mouth to look for any tumors. Another thing is stomatitis. Stomatitis is basically inflammation of the mouth. So you can have ulcers and redness and inflammation and raw areas on the tongue, on the gums, on the lips. Mainly it's on the gums and tongue. And so this is actually kind of an allergic reaction to the body's own tissues. So it's an autoimmune disease, auto meaning self, immune meaning the immune system. So basically the body, the immune system is fighting against itself. And so it will do this sometimes as a reaction to tartar and bacteria on the teeth. Some cats, their immune system is really sensitive to that bacteria on the teeth, and they'll mount an immune response to the bacteria. And so in a lot of cases, just really good dental cleaning, even every 6 months sometimes, can help manage this, along with some anti-inflammatories and stuff like that. Sometimes it's severe enough that they're actually reacting to their own teeth. And in those cases, we obviously try the dental cleaning and the anti-inflammatories, and if it just doesn't resolve, this syndrome is so painful that our only option is to remove all of the teeth in the mouth. And the cats do very well. They're much more comfortable, less pain, no longer having inflammation in the mouth, and they can eat quite well, without those teeth. And so, unfortunately, this is the treatment in some cases. And then the last syndrome I want to talk to you about is called feline orofacial, so mouth and face pain syndrome. It's very rare. I've actually never seen it myself, but I know about it because of our studying and research and stuff. And so it's most common in Burmese cats. So if you have a Burmese or a Burmese cross, something to watch out for. And it's basically a neurologic syndrome that nobody really knows exactly why it happens. There's a similar syndrome in humans called burning mouth syndrome. And so basically it usually has sudden onset, so very quick, and there's severe pain and burning sensation of the mouth. And so the cats will drool and lick and chew and paw at their mouth, and it can be pretty severe. And so obviously when they come in with that, we need to do all of the diagnostics, find out why they're doing that, make sure that there's none of the other things I just talked to you about. Sometimes even an MRI is needed. And then if it's found out that this is the syndrome, then we put them on neurologic medications, anti-seizure medications, pain medications to try and manage this. Some cats even need like a cone so they're not clawing and injuring their skin and stuff because of the pain. And so the prognosis is pretty fair. Not all of them actually resolve, but we can get a much better comfort level in most of them. So basically the main point is look at your pet's mouth. On a routine basis, I always recommend like a monthly home vet check to look at everything and check for any problems. And take care of your pet's teeth and mouth, because it's very important, and it dental problems can relate or progress to many other issues. So I hope everybody has a great day, and let us know if you have any questions or comments. Take care.